Hi, I'm Srividya Iyer. I'm a professor in the Department of Psychiatry at McGill University in Montreal and a researcher at the Douglas Research Center. I'm a psychologist by training. My interests are really in the mental health of young people, and I'm involved in many projects nationally and internationally that are helping to create services that are accessible, high quality, effective, youth-friendly, and holistic. So why the focus on youth mental health? We know that over 60% of mental health problems start before the age of 25. We also know that many critical milestones in life, like finishing school, finding love, finding a job, also happen in this age. So youth is really a period of promise and potential. And when mental health problems occur during this age and they go untreated or poorly treated, they really can have significant impacts. On a more positive note, youth is also a period where we can really do something and intervene and impact positively long-term trajectories. I think part of the problem is also that services that we do currently have rarely been designed with young people. So what you end up seeing are services that don't speak to them, that are really not friendly, that are not culturally appropriate or safe. So there's really a range of issues, and some of these issues are even more compounded for some young people. So some young people, for example, who might be living in rural or remote areas, or young people who might live in contexts that have traditionally been underserved, such as Indigenous young people or young people who are at risk of homelessness, youth and child welfare. And we also know now very well that many of these same factors, or what we call social determinants, tend to hang together or tend to intersect, making it even more likely that some young people experience greater difficulties accessing high-quality mental health services. So how can research help to fill some of these gaps? We were funded for this really ambitious youth mental health research project called Access Open Minds, which was jointly funded by the Canadian Institutes for Health Research and the Graham Beck Foundation. And this project really brought together youth, families, service providers, community organizations, Indigenous leaders, decision makers from 16 sites across Canada. And part of what we figured out is that if we are to answer these questions and if we are to fill equity gaps, we really need to make sure that all relevant stakeholder groups are part of the table, and including community partners and young people with lived experience are part of the discussion from the very beginning. So we're currently here in Iyer in Kirkland. It started in fall 2023, and part of the momentum that started with Access resulted in integrated youth services initiatives in most provinces in Canada. The idea is pretty simple. The idea is really that we need to create a one-stop shop or one hub where young people can come in to get a range of services that they may need. It's really cool that we now have initiatives like Iyer, not just in Quebec, but in almost all provinces.
C'est ce qui me motive aussi de travailler avec les jeunes, c'est qu'on veut protéger les jeunes, mais aussi pourquoi est-ce qu'on veut les protéger, c'est que c'est eux qui nous font avancer comme société, c'est eux qui nous donnent, c'est eux qui nous font progresser. Donc, tu sais, de protéger ça, puis on sait que ça nous amène vers encore plus de développement de société.
Donc, en fait, ce que j'ai vu depuis le début de l'implantation du projet à Rouverte, ici dans notre secteur, c'est qu'en intégrant la perspective de toutes les parties prenantes, donc les jeunes, les familles, les proches, les organismes communautaires, les intervenants scolaires, les intervenants du CIUS, on voit que ça répond réellement à leurs besoins et que les services, c'est essentiel de les impliquer en fait, parce que sinon les services seraient complètement différents puis on ne répondrait pas à leurs besoins.
We also have an Indigenous Integrated Youth Services Network that really stems from the work that Access Open Minds and its Indigenous partners did, and that really tries to include Indigenous communities from across the country rather than one jurisdiction at a time.
So I'm Gustavo Turecki. I'm the Scientific Director of the Douglas Institute. It's important that people who are vulnerable, people who have early signs of mental health problems, that they have easy access to service, because the sooner they have access to services, the better is the outcome. So Dr. Iyer has done a lot of things. So she's really been a leader in the implementation of these programs. So today, in part as a result of the work of Dr. Iyer, Canada is seen as a leader in youth mental health and in access to services and understanding how services should be organized.
I'm very grateful to be the recipient of the Royal-Mach Gaensslen Prize in 2023. I think the prize is very prestigious, and I'm very grateful that a foundation such as this has chosen to recognize the importance of youth mental health services research through this prize and is supporting some of the directions that it can take in the future. But overall, I really think that we can dream, at least I certainly have this dream of a future where young people, no matter where they are living, have access to good, high-quality, publicly funded mental health support, and more importantly, to an environment and supports that they need for their flourishing and well-being.